This is Kayla Bain to do my CVC dressing change. I'm going to show you my area now.
This was a good book.
I did have a patient lined up but they kind of ended up not being able to help me at last minute, so I'm kind of having to improvise. This is going to serve as my patient. That's my central venous line that I'm going to be changing. And that actually isn't the line, it's just an NG tube that I'm using at this time. So I'm going to set the camera down and then we'll get started.
This one here.
So before going into the patient's room or anything like that, I double check to make sure that I have all my supplies, that the doctor has ordered the dressing change, and that the date is, the dressing actually is supposed to be changed for the date. During a dressing change, a CVC dressing change, you want to make sure that you wear a mask, just protect yourself, and also have the patient either look away or themselves wear a mask. Just because it's easier for me to talk, I'm going to just pretend I'm wearing one while I'm wearing it, and I'll let you know when I do.
I got you. Where are you?
So I've checked everything, I've made sure that I have all my supplies, that the dressing doesn't need to be changed, that this is the right patient, right date and right time, right room number and everything like that. So before doing anything, I'm going to palpate the area to see if there's any pain, look around if there's any redness, any drainage that's visible from it. Patient says no, so I'm going to go ahead and loosen the tegaderm from the outside in. And before I actually take it off, I would put my mask on. And I'd also have my patient wear a mask or look away. So I have my mask on. So my tegaderm is loosened.
Oh, smooth.
Girls.
I'm watching.
So I've loosened my tegaderm. I've taken it off. You want to make sure that you note any drainage that there is, type, amount, color, and order. You don't want to chart that at the end. So I'm going to take my gloves off, put my Purell on, wash my hands. I'd also want to note any skin irritation that there might be from girls. Any skin irritation there might be from the adhesive of the dressing.
Girls, come over here.
Thank you, girls. So I'd want to sterilely open my supplies unit. I need a tegaderm, which I know these are previously open and don't have any extras, so that's what I'm doing. Then a sterile 2x2, a ChloraPrep, then also my sterile gloves. I'm just going to move these aside quick. These are still sterile. And at this point I still have my mask on. And don your sterile gloves. So my gloves are on, they're good fitting, so the inside of this is still sterile, so I'm just going to slide it off. Keep your hands above your waist. Now for the ChloraPrep. You don't want to break it towards your patient or yourself, so you're just going to break it into a garbage can. And so I'm going to scrub in a square. This friction activates this kind of cleaning agent. Making sure to keep yourself, don't turn your body to your sterile supplies. So I cleaned one side, the bottom side, and then the other side. And to get underneath the lumen, you're going to want to, you're going to have to contaminate your pinky. I'm going to use my undominant hand, so I'm going to lift the lumen up and scrub underneath. Okay, I have that pretty clean, so I can throw that away. Now I'm going to grab my sterile 2x2. I'm going to lay that over the site. I'm going to grab my tegaderm. Remembering to keep my dirty pinky out. And there's a little notch on the top of this tegaderm. You kind of want to lay that across the top where the sutured in little bump port is. That on, build up. Okay. So everything looks good. It's sitting on there nicely. The tegaderm is adhering well. I'm going to take this little piece of tape here. I'm going to write on it my initials, the date, and the time. I'm going to put that on here so just the next person knows when this dressing was placed. I can take my gloves off now because the sterile part is done. And then I'm actually going to take a piece of tape and kind of tape the lumens to the patient just so they're not flopping all over the place. So I would clean my area, make sure the patient's bed is at the lowest position, side rails are up, that they're comfortable, their call light is within reach. I've taken this away and do all my charting and make my assessments, and that's